Dear students, in this video we will discuss about the reproductive health. The complete well-being with respect to all aspects of reproduction like physical, emotional, behavioral and social. A society with people having physically and functionally normal reproductive organ as well as normal interactions with respect to behavior and emotion among them is reproductively healthy. First of all, we should discuss about the problems and strategies in this field. Family planning measures were initiated in 1951 in India. The goal was to attain the total reproductive health. These measures were periodically evaluated. Reproductive and Child Health Care (RCH) programs are being operated with the aim of creating awareness among people about various reproduction related aspects and providing facilities and support for building a reproductively healthy society. Steps to achieve reproductive health. Government and non-government agencies should use media, both print and audio visual, to create awareness programs. Responsible adults, parents, teachers, close relatives and friends should provide correct information and be willing to open dialogues with young adults and children to sensitize them about reproductive health. Introduction of sex education in schools and colleges. Create awareness about sexually transmitted diseases or STDs. Educating people, especially fertile couples and marriageable individuals, about birth control options. Pre and postnatal care. Infant and child care importance of breastfeeding, equal opportunities for males and females will help in bringing up socially conscious and healthy families of desired size. Create awareness about problems of population explosion, sex abuse and sex-related crimes. Provision and availability of strong infrastructural facilities, professional expertise and material. Support for successful implementation of health. These also help in providing medical facilities and care to people with reproduction related problems. Implementation of newer, better and upgraded facilities with respect to reproductive health. Complete ban on fetal sex determination to check female feticide. Large scale child immunization programs. For decreased maternal and infant mortality rates, there should be better awareness of sex-related matters, increase in medically assisted deliveries, better postnatal care leads. Improved reproductive health of the society is indicated by smaller families, better detection and cure for STDs. Overall, increased medical facilities. Now let us talk about the population explosion and birth control. The rapid growth of population of a particular species, especially of the human in the world. Since the end of World War II, this can be attributed to a constantly increasing birth rate, a decreased child and infant mortality, and an increase in life expectancy. This will lead to increased stress on all resources. Causes: rapidly declining death rate, rapidly declining maternal mortality rate MMR, rapidly declining infant mortality rate IMR, increased life expectancy, increase in number of people in reproducible age. Methods to control population explosion by promoting smaller families, promoting use of contraceptive methods, raise the legal age for marriage 18 years for female and 21 years for males. Incentivize couples with smaller families. Ideal contraceptives should be easy to use, should be easily available, should be effective, should not have side effects, should be reversible, should not interfere with the sexual drive, desire, or act of the individual. Main methods of contraception: natural or traditional, barrier method, intrauterine devices IUDs, oral contraceptives, injectable and implants, and surgical methods. Let us talk one by one. First, natural methods. It works on the principle of avoiding the chances of sperm and egg meeting. Periodic abstinence. In this method, couples avoid coitus between 10th and 17th day of the menstrual cycle, as during this period the chance of ovulation is maximum. Therefore, abstaining from coitus during this fertile period decreases the chance of pregnancy. Withdrawal or coitus interrupts. In this method, the male withdraws the penis from the vagina during coitus, just before ejaculation. Therefore, he prevents the release of semen and thus prevents insemination. And the third one is lactational amenorrhea. This is the period of absence of menstruation during the period of lactation. As there is no menstruation, it is believed that during this period there is no ovulation and therefore decreased chances of pregnancy. However, this method is effective only up to 6 months after parturition during the period of intense lactation. As no chemicals are used, the chances of side effects are nil. However, success of contraception is also limited and therefore chances of failure of contraception are also high. And the next method is barrier method. In this method, sperms and ovum are physically prevented from meeting with the help of barriers like condoms. Barriers made of thin rubber or latex sheath that cover the penis in males and in the cervix in the females. Both male and female condoms are disposable, as use of condoms prevents contact of genital fluids. It also helps in preventing STDs. Reusable barriers like diaphragms, cervical caps, and vaults are inserted into the female cervix during coitus to prevent the entry of sperm through the cervix. Spermicidal creams, jellies, and foams are used with these barriers to increase the efficiency of these methods. Intrauterine devices. These devices are inserted into the uterus by doctors or expert nurses through the vagina. Non-medicated IUDs like lips hoops increases phagocytosis of sperms. Copper releasing IUDs like copper T, copper 7, multi-load 375 decrease motility of sperms. IUDs that release hormones like progesterone, LNG20 make the uterus unsuitable for implantation. They also make the cervix hostile to sperms. These devices are ideal contraceptive for the females for family planning and are among the most widely used methods of contraception. Oral contraceptives. This involves the oral administration of progesterone or progesterone-estrogen combinations in the form of pills. They are used by females for a period of 21 days, starting with the first 5 days of the menstrual cycle. After a gap of 7 days, during which menstruation occurs, the cycle is repeated until the female wishes to conceive. Newer pills like Saheli are once a week non-steroidal pills with lesser side effects. These pills work by inhibiting ovulation and implantation as well as altering the quality of cervical mucus to retard or prevent the entry of sperms. Injectable and implants. Progesterone alone or in combination with estrogens can be used by females as injections or implants under the skin. Such injectables and implants are functionally similar to pills and their effective period is much longer. Now the discussion about surgical method. Surgical intervention functions by blocking the transport of gametes and thereby prevent conception. They are terminal methods of contraception and are therefore also called as sterilization. Sterilization in males called as vasectomy and in female is called tubectomy. Vasectomy, vasa deferens is tied up or removed through a small incision in the scrotum. Tubectomy is also a small part of the fallopian tube is tied up or removed through a small incision in abdomen or the vagina. These methods are highly effective, but their reversibility is very poor. Contraceptive methods help in checking population explosion. However, different methods of contraception may also have some side effects like nausea, abdominal pain, breakthrough bleeding, irregular menstruation, breast cancer, etc. Now the discussion about MTP, medical termination of pregnancy. Termination of pregnancy before the completion of full term intentionally or voluntarily is called medical termination of pregnancy or induced abortion. MTP has a significant role in decreasing population through it is not means for that purpose. The Government of India legalized MTP in 1971 with some strict provisions to prevent its misuse. Why MTP? To prevent unwanted pregnancies. In cases where continuation of pregnancy is harmful or even fatal to the mother or fetus or both. MTPs are safe in the first trimester. However, MTPs during the second trimester are riskier. A dangerous trend is that MTPs are performed by quacks or unqualified doctors, which may turn fatal for mother. Also, use of amniocentesis or other methods of prenatal sex determination may lead to female feticides, as the preference for male child is very high. Now the talk about the sexual transmitted diseases. Diseases or infections of the reproductive tract which are transmitted through sexual activities and intercourse are called sexually transmitted disease or venereal disease or reproductive tract infection (RTI). gonorrhea, syphilis, genital herpes, chlamydiasis, genital warts, trichomoniasis, hepatitis B, HIV, leading to AIDS are some of the common STDs. Among these, HIV infection is most dangerous. Hepatitis B and HIV can also be transmitted by sharing of injection or surgical implements with infected persons, transfusion of infected blood, transmission from infected mother to fetus, etc. Except for hepatitis B, genital herpes, and HIV infection, other STDs are curable if detected early. Some common symptoms for STDs include itching, fluid discharge, slight pain, swelling, etc. Individuals may remain asymptomatic for a long time. This, coupled with the stigma associated with STDs, are the major reasons many STDs remain undetected. This could lead to complications later, which include pelvic inflammatory disease (PID), abortions, stillbirth, ectopic pregnancy, infertility, or even cancer of the reproductive tracts. STDs are a major threat to obtaining a healthy society. Reproductive health care programs. Steps to prevent STDs. Avoid sex with unknown or multiple partner. Always use condoms during coitus. If in doubt, go to a qualified doctor for early detection and treatment for the diseases. Last but not least, we should talk about the infertility. Infertility is the inability to produce children in spite of unprotected sexual cohabitation. Reasons could be physical, congenital, diseases, drugs, immunological, or even psychological. Often female is blamed for being childless, but the fault could more often that not lie with the males as well. Specialized healthcare units like infertility clinics could help in corrective treatment of some of these disorders. In case corrective treatments are not possible, couples could be helped with assisted reproductive technology (ART). Few terms related to this. IVF, in vitro fertilization. This involves fertilization of gametes outside the body in conditions that mimic the body conditions. The fertilized zygote is then induced to divide to form the embryo. The embryo is then transferred in the uterus of the female. ZIFT, zygote intrafallopian transfer. The zygote or early embryo up to 8 blastomeres can be transferred into the fallopian tube of the female. Intrauterine transfer. Embryos with more than 8 blastomeres can be transferred directly into the uterus. Gamete intrafallopian transfer. The ovum from the donor is collected and transferred into another female who cannot produce one but can provide conditions for fertilization and further development. Intracytoplasmic sperm injection (ICSI) is a specialized procedure that forms an embryo in the laboratory by directly injecting a sperm into the ovum. Artificial insemination technique. In this technique, the semen collected either from the husband or a healthy donor is artificially introduced either into the vagina or into the uterus. IUI, intrauterine insemination of the female. All these methods require certified experts handling the procedures with high precision. They also need expensive instrumentation. Legal adoption is another good method for couples looking for parenthood. Thank you and have a nice